Hi Jonathan, welcome to the team. We're very excited to have you here at the clinic. Today I'm going to go through how to wash your hands properly, and this is to protect yourself, our clients, and co-workers from spreading infection, disease, and all that kind of stuff. So to get started, we're going to want to have a good body position here. Body mechanics prevent strain and injury to your back. And to prepare to wash your hands, you're going to want to remove any jewelry if you wear any, as microorganisms can get stuck in there. And you're going to want to roll up your sleeves to above your elbows like I have here. You're also going to want to stand back from the sink so that no microorganisms can get from the sink to your uniform and to yourself. So we're going to turn the tap on to a moderate flow. And this is to prevent splashbacks from the water onto yourself with the microorganisms. And the water is going to be at a warm temperature to remove less protective oil from the skin. So we're going to hold our forearms down like this when we're washing, and this goes from least contaminated to most contaminated. This prevents the water from dripping back up the arm and contaminating your clothing. Water should flow from least contaminated to most contaminated area. Next, we're going to use soap, about 2 to 4 milliliters. There. If you're using bar soap, rinse the soap before returning it to the soap dish. And now we're going to start at the top of each forearm, and we're going to rotate down to the wrist in this rotating movement, lathering arm from area of least contaminated to the area of most contaminated. We'll do the other side, start at the top of each forearm and stop at the wrist. Continue using firm, rubbing, circular movements to work up a lather. Next, we're going to rub the back of our hands in this rotary motion, and this helps to remove microorganisms as well from the back of our hands. And then we're going to interlace our fingers, and interlacing cleans the spaces in between the fingers and move our hands back and forth. It's important at this point to not touch the sink with any part of your body or your hands. And with fingertips facing down, starting at the top of the forearm, rotate one arm at a time under the water so it flows from lathered area of the forearm to fingertips. Water should flow from least contaminated to most contaminated area. Then you're going to use a clean paper towel to dry yourself off. You're going to pat dry from the top to the bottom. And it's important to dry your skin because moist skin becomes chapped, and chapping breaks skin surface, which can result in an infection. When you're done drying, you're going to discard the paper towel in an appropriate waste bin, and then you're going to grab another piece of paper towel, and you're going to shut the sink off with that and clean up any drips around the sink. Microorganisms may be transferred from wet paper towel to clean your hands, and when we discard our paper towel properly, it maintains sepsis within the facility. So I hope you learned something today on how to wash your hands. We look forward to having you here in the clinic, and best wishes. We'll see you soon.